Hi guys, Heather here. I had this dream that some of you were asking me, Heather, what the heck do you do all day? And you know what? I was kind of wondering the same thing. I woke up one morning completely out of my mind and decided to go to work and find out exactly what it is that I do all day. And let me tell you, I'm exhausted. So you know what? I'm gonna go get a little bit of rest and then I'll tell you about it later. So when I first got to work, there was a bunch of nurses standing around the nurse's station talking about patients, and then this night nurse runs up to me and starts talking to me and going on and on about these patients that I'm supposed to take care of during the day, and I have no idea what he's talking about or why the patients are in the hospital, but I guess I'm there to help, and I'll do my best. Then I look the patients' profiles up, and I'm told to look up the labs and report any abnormals to the doctor, and I had to find out what those abnormals were really quick. Then I noticed there were all these meds that need to be given, like mass amounts of meds, and I had no idea what they were for. So I prepared them, and one of the patients says, "Why are you giving me so many meds?" and starts cussing at me and tells me he's going to have this huge hospital bill. And I'm like, "Sir, the doctor ordered them for you to help treat you." And he's like, "No, you guys are all trying to kill me." And so after convincing him that we're not going to murder him, he finally took his pills, which for a minute there I thought he was going to throw them at me. So I was preparing myself to duck out of the way. Then there's this thing called head-to-toe assessment where you have to assess the patient from head to toe. That makes sense, right? And then you have to chart it. Oh, so much charting. I felt like I was back in college, like writing a big paper or novel or something. The patients really seem to like attention because they're always calling me in the room to ask me questions and telling me to get them stuff, and I guess I could take that as a compliment. At least they're not telling me to get the heck out of their room. One of the male patients wanted me to help him with his urinal, and I wasn't sure if that was appropriate or not, but one of the other nurses said it was okay to help him. Then I noticed most of the patients had like these little plastic toy things sticking out of their arm. I think they're called IVs, and they're used for fluids and antibiotics. Kind of cool looking. And then I was forced to stick patients before meals to test their blood sugar and give them insulin. I wasn't sure if that was humane or not, but all the other nurses were doing it, and I wanted to fit in and make friends, so I did it too. So that's how most of my morning went, when I wasn't sending a patient down for surgery, trying to stop a patient from bleeding to death, picking up a patient off the floor after he decided to bungee jump off the bed, and then doing CPR somewhere in between there. Well guys, thanks for watching. Talk to you soon, okay? Bye!